We have our chief guest for today, Mr. S. Ramadorai with us, who is a well-recognized global leader and technocrat who has participated in the Indian IT journey from a mere idea in 1960s to a mature industry today. He took over as the CEO of Tata Consultancy Services in 1996, and since then has led the company through some of the most exciting phases, including going public in 2004. In October 2009, when he retired as the CEO, he was appointed as the vice chairman of TCS and held office till 2014, an association of over 4 decades. His book, The TCS Story, was published in 2011, which captures his exciting journey at TCS, which remained a bestseller for many months. Mr. Ramadorai is currently the chairman of the advisory board of Tata Strive, which is the Tata Group's CSR Skill Development Initiative, and he's also the chairman of the governing board at Tata Institute of Social Sciences. He was awarded the Padma Bhushan in January 2006. He has been honored by Her Majesty Queen Elizabeth II for his contribution to the Indo-British economic relations. In 2016, he was also awarded the Economic Times Lifetime Achievement Award for his glorious contribution to CCS. Ladies and gentlemen, it is our honor and privilege to see and hear this visionary, legend, leader, innovator, social worker, Mr. S. Ramadorai, today at CAHOTECH 2020. Sir, we invite you to deliver the valedictory address. Over to you, sir.
Thank you so much. Today is World Heart Day. So I pray for all of us to have a healthy, good, and a warm heart. Dr. Ravindran, Chairman, Arvind Eye Care System. Dr. Lee, Director, Department of Medical Affairs and Planning, Taiwan. Dr. Vijay Agarwal, President, Consortium of Accredited Healthcare Organizations. Mr. Som Mittal, former President and Chairman, NASCOM India. Mr. Samir Mehta, Senior Executives of the Consortium of Accredited Healthcare Organizations and participants of CAHOTECH 2020. Ladies and gentlemen, a very, very good evening to all of you. I hope your families are in good health and safe during this pandemic. I feel privileged and honored to be invited to deliver the valedictory address to this very distinguished audience, more importantly from the healthcare fraternity. In fact, there are many of whom I've had the privilege of knowing personally too. Let me take this opportunity to express my immense gratitude to you and your teams that have been working relentlessly since the wake of this pandemic. I've been following the news very closely and see the pride each of you take in standing strong even though intense fatigue has set in on every front. We can only hope that a vaccine is developed soon, and most importantly, that its distribution is managed in an equitable way which benefits all without fail. So now coming back to this session, as I glance through the program, and as mentioned by Dr. Vijay Agarwal, there's been a very interesting 5-day sessions where topics like faster adoption of telemedicine, future of learning, breakthroughs, disruption and innovations in connected care, hospitals of the future, and the next generation healthcare for the country, as I understood, were covered extensively. I'm sure this conference has brought to light some interesting aspects relating to our knowledge and experience to enable us to prepare for the healthcare challenges which are among us that lie ahead of us. I think the pandemic has not only been a visible impact, but as a global economy, it has had a very visible impact. The health crisis has morphed into an economic catastrophe for the entire world. Now, this COVID-19 is likely to have a prolonged and a profound long-term impact across all sectors, be it tourism, hospitality, education, and even technology. Even countries such as the US and the UK or Europe that conducted exercises in planning for an epidemic in the past failed to anticipate the toll the pandemic would have. The healthcare sector all over the world was unprepared for an epidemic of this scale that would bring to the front the challenges like acute shortages of intensive care beds, ventilators, personal protection equipment, and masks for the healthcare workers, even amongst the most developed nations of the world. But for the country like India to step up in each of these fronts, through the government initiative, through the private initiative, through the startup initiatives, or public-private partnership, has been a remarkable story which should be captured as we go into the future. In countries with state-funded healthcare system, the response to the pandemic was the most effective. Whether you take a Singapore, Taiwan, New Zealand, or Japan, these were some of the countries who were able to manage this pandemic as they implemented measures with regard to health and hygiene right away. What gave these countries the advantages was uniform access to healthcare. Access to affordable and quality care is extremely important and critical to battle a pandemic at this scale. Ladies and gentlemen, as per an estimate, over 2 billion people across the globe lack access to basic medicines because of the remote locations they live in. This is where, with the intervention of technology, simple measures can be deployed to reach them. When I talk about an unmanned aerial vehicles or drones, as you call them, they are an excellent way to modernize the last mile in medical deliveries and bridge the gap in access. Given that some health systems cannot afford to keep cold chain products, such as platelets or blood on site, drones can ensure just-in-time supplies of key medical supplies regardless of location in times of emergency. For example, Zipline, a California-based medical product delivery company, has been delivering medical supplies by sending drones to rural communities in Rwanda and Ghana in Africa. It may be encouraging to note that the trips that make an entire day by car takes less than 30 minutes by drone. While the lockdown restricted the availability of raw materials, interrupted the supply chain, and made labor scarce, several healthcare startups augmented or revamped their existing resources to fight the pandemic. The Public Health Foundation of India and a Telangana-based company called Marut-Drone-Tech are in the process of re-engineering their drones to help with disinfection and surveillance across the 19 districts in Telangana. For the last year and a half, Telangana's Marut-Drone-Tech has been working on solving 4 major issues: mosquito eradication, afforestation, medical delivery, and agriculture using technologies like Internet of Things, artificial intelligence, and of course, drones. Mitra, Invento's flagship robo that was earlier used in hotels and banks was modified to collect patient details, check temperatures, and set up video calls with doctors, thus minimizing contact with healthcare workers. Institutes like the Public Health Foundation of India are already working on the use of technology in the healthcare ecosystem. The projects like the Swasthya Slate, which is a basic decision support system-based diagnostic tool, is helping deliver the last mile diagnostic services in the rural areas for home caregivers. Another important use of modern day technology by PHFI is the computer-aided cancer diagnostic tool, which helps identify digital photographic images for any pre-cancer lesions with the help of machine learning. The COVID-19 outbreak has brought untold miseries to many businesses, but the health technology landscape has grown through it. devising ingenious mechanisms and technologies to essentially face the public healthcare crisis. While the loss of lives in the pandemic is truly unfortunate, the crisis has also significantly reinforced the importance of healthcare and wellness globally. Over the past several years, the healthcare industry has witnessed a gradual shift from volume-based models to value-based and collaborative models. We also have seen a bundle of events unfold, triggering the emergence of new ecosystems driven by the identification of social determinants of health, focus of big firms in healthcare, increased focus on patient experience, and a closer look at democratization of data. Partnerships and collaborations between private entities and public partnerships will lead the way for the next generation of healthcare and have already begun seeing numerous such collaborations. But both the COVID and in the post-COVID era, we will have to really rethink collaborations and partnerships from a different perspective. One of the recent collaborations during this pandemic just announced is the partnership between the Tata Group and the Council of Scientific and Industrial Research for the development of Feluda, the low-cost COVID test. The joint effort is the result of a fruitful collaboration between the scientific community and the industry. The Tata Group has closely worked with CSIR, IGIB, and ICMR to create a high-quality test that will help the nation ramp up COVID-19 testing quickly and economically with a made-in-India product that is safe, reliable, affordable, and of course, accessible. The Digital Nerve Center is a solution being developed by Tata Consultancy Services, which involves transformation across 4 layers of healthcare delivery, touching the last mile challenges in healthcare delivery, especially in a country like India, in a public-private partnership model. I think there are numerous other manufacturing technologies between the CSIR and the Tata Group with regard to manufacturing the ventilators and the personal protection equipment. If India is to leverage the advantages of a thriving healthcare ecosystem, both for its domestic needs and as a means of exporting this technology to other countries, then certain steps must be taken. We remain convinced that India can learn from the experience of dealing with COVID-19. This would enable us to put in place systems that will not only take care of the needs of our population in normal times, but also enable us to cope with additional demands placed on the healthcare sector in times of an epidemic. Primary healthcare is not a single service, but a multitude of services delivered by people with limited skills in a resource-constrained ecosystem of environmental, social, and cultural diversity. Presenting situations are almost always include mix of verticals, specialities, and ecosystem determinants. We need to build a supply chain of healthcare providers, especially the primary healthcare workers. Skill development in this sector is of utmost importance, keeping in mind the current pandemic where the doctors, nurses, ICU teams, ward boys, lab technicians, etc. are exhausted due to the lack of manpower. The Public Health Foundation of India is also implementing different training programs for capacity building that aim to upgrade the knowledge and skills of primary care physicians in disease management. To prepare ourselves for the future, we need to build a specific ring-fence support ecosystem for innovative healthcare practices and devices. Given the high percentage of Indians living in rural areas, primary care is the most important need for the population. India has its share of corporate hospitals providing world-class healthcare to those that can afford it. However, every effort should be made to make such care accessible to one and all. Most of these objectives can be fulfilled when we develop a strategic plan for self-reliance and make appropriate allocations of funds towards the same. Such projects in the long term will become self-sustaining with potential exports revenues coming in. Given the experiences during this pandemic and the opportunities thrown forward by this pandemic, Like I said, there are several startups who have come with very innovative ideas. Several startups rose to the occasion by providing quick solution. Example, Medicine from the Sky, or a World Economic Forum initiative in partnership with the state government in India and the Apollo hospitals in India that have been trying to scale up drone-based medical deliveries in the region, to name a few. However, majority of health tech startup funding calls are primarily focused on molecular research, drug discovery, and vaccine development. Traditionally, vaccine development has always been a very long-term, long time, and in several cases, even several decades. However, in the case of COVID-19, what we are witnessing, new technologies combined with international cooperation to fight infectious diseases are enabling very, very quick responses, removing several years from traditional timelines. Technological advances in immunology, protein design, and genetic delivery have unlocked new possibilities for vaccine concepts and delivery technologies that were previously inaccessible. The Ministry of Health and Family Welfare initiated the creation of several health technology assessment centers across the country. These centers should take an active role in assessing and evaluating newer concepts proposed by the startups and provide some validation to their efficacy and recommended utilization. The future of health is likely to be driven by digital transformation enabled by radically interoperable data and open source and very secure platforms. Based on emerging technologies, we can be reasonably certain that digital transformation enabled by radically interoperable data, artificial intelligence, and open secure platforms will drive much of this change. Unlike today, we believe care will be organized around the consumer rather than around the institutions that drive our existing healthcare system. The responsibility of encouraging innovation and implementation of cutting-edge technology should be further encouraged by the Indian Council of Medical Research. We remain convinced that given the low entry cost, ready availability of highly trained talent, and commitment to scale up manufacturing in India, we can certainly encourage our innovative thinking and enable the thriving startup culture. It now remains for our political leadership to strategize, motivate, and inspire our talent to put India on the world map for healthcare. Predictive medicine is another great change that we are going to see in the future. The IoT, Internet of Things technology, has been a big part of our lives for quite some time now, and it is becoming a part of the healthcare industry as well. Instead of nurse checking on the patient's vital functions several times a day, network machines can send the needed data to a controlled room. This enables prompt and correct action to be taken when some of the vitals show irregular activity. But IoT will make another important change. Essentially, it will personalize health. Just think about it. Your smartwatch already collects data about your blood pressure, your heart rate, water intake, sleep patterns, and much more. But you probably do not have the time to analyze that data. Today, if you are a patient with chronic blood pressure issues, this data could immediately trigger information to your doctor in an emergency that would enable them to take prompt action before the patient's healthcare deteriorates. Everything we talked about so far leads to an important conclusion. The healthcare system is essentially being directed towards prevention and timely diagnosis. Instead of expecting patients to show up with a problem that already shows symptoms, technology and data science will enable them to recognize and prompt them before the problem gets acute. Telemedicine has become a real thing. It's an aspect of medicine focused on providing preventive care. Different apps and websites let people find answers about various symptoms, such as an increase in body temperature or blood pressure fluctuations. Several websites today allow people to see a doctor for video consultations. This has in fact gained more popularity in the wake of current pandemic. This includes education and skills as well. How we look at healthcare and the expectations of patient care delivery are essentially evolving at such a rapid pace, it's unfathomable. Although the pandemic has put pressure on organizations currently, it's also a motivation for the healthcare industry to deep dive into the existing challenges and be aware of the available solutions with an agility to adopt quickly. Adoption and implementation on the ground is absolutely critical. Technology in healthcare, like many other sectors, plays a crucial role in sustaining business and bouncing back from the prevailing impediment. Smart organization will adapt and come through the other side of this crisis triumphant. Before I end, I would like to touch upon another important aspect, that of mental health. Today, India has one of the largest population affected by mental health and mental illness, be it autism, depression, anxiety, substance abuse, psychosis, or dementia in old age. As per the Global Burden of Disease Study estimate, nearly 200 million people in India have experienced a mental disorder, nearly half of whom suffer from depressive and anxiety disorders. In the current COVID-19 situation, one can consider the impact of the pandemic on mental health in two phases. The first phase, which coincided with the lockdown, the period when the pandemic surged through the country. There have already been a spike in mental health cases in the last 5 to 6 months. The second phase will unfold in the months ahead as the virus starts to get contained, but the economic fallout of the pandemic begins to bite deeper. Given the size of this challenge facing the country, only technology can offer much needed scale, access, and equity in mental health services. For example, iCall, initiating Concern for All, a pioneering mental health project for the School of Human Ecology at the Tata Institute of Social Sciences. Mumbai has been providing professional and free counseling through technology-assisted mediums such as telephone, email, and chat to anyone in need of emotional support, irrespective of age, gender, sexual orientation, and race, transcending geographical distances, while ensuring confidentiality. Can go on and on, like the National Institute of Advanced Studies, or the Axis Bank Foundation, which looks at livelihood, or the Center for Spatial Analytics, which can, in a very smallest area through the satellite technology, zone in on certain very specific areas to address some of these issues. With these words, I hope the deliberations and discussions of this conference will encourage all of you to look, and all of us to look at the much needed next steps or the next era in the healthcare delivery system, using technology primarily to ensure accessible and affordable to every Indian. Thank you for inviting me, and thank you so much. Have a pleasant evening. Stay safe.
Thank you so much, sir, for your words of wisdom, for your insights into healthcare technology. And it's really great to have you here on CAHOTECH 2020.